Hello, welcome in. I'm Dr. Shwin. How are you? Great, okay. I see here that you're in for an ENT exam. Yeah, an innocent throat exam. Yeah, okay, great. So, I just want to confirm your name and date of birth on my chart. So your name. And then how do you spell your last name? Great, and then your date of birth. Okay, good. Before we get started with this exam, I do have to apologise for any construction noise that you hear. It's a very busy day outside the clinic because very big day for the construction. Yeah, so do you have any problems with your ears? It says that you do have some minor pain in your ears. And that was a week ago, so has it gotten any worse? Okay, great. And do you have any treatment for that? Okay. Cool. And then, do you have any problems with your nose? Okay. Have you had any problems in the past, like 5 years with your nose? Okay. And then your throat. Has anything been going on with your throat? Okay, interesting. So a sore throat, but worse than like a cough or a cold. Okay, yeah. Speaking of, have you had any recent coughs or colds in the past like 6 months? Okay, interesting. I'm gonna go through a bunch of symptoms and I need you to confirm with me whether you are experiencing any of these, okay? Great. So, are you experiencing any headaches, migraines, ringing sounds in your ears, popping sounds in your ears, muffled sounds, vertigo, currently, dizziness, nausea? Okay, wonderful. I mean, not wonderful, but it gives me a good idea what's going on. Do you have any allergies that I should be aware of? Okay. Sorry, sometimes the light does go out in the office. Yeah. Awesome. So this exam is going to require a lot of me touching your face and your chest. So chest, neck, nose, mouth area, jaw. Is that all good with you? Great. Okay. So let me sanitize my hands before we get started. So I'm just gonna inspect your jaw, see what's going on. Okay. Interesting. And then inspecting the outside of the ear, the outside of the ear. Okay, interesting. Yep, and then down, lower. And I'm going to inspect the other side, the other side, the other side. The other side, the other side, the other side. Okay, interesting. So it does look like your neck area is very tender. And it feels quite swollen, so I think that is quite a major issue with your throat right now. And then your jaw seems also a bit tender over here, but I think it's mainly what it is that are having quite a big problem with the face. So I just go into there, just start this. Yeah, okay. Interesting. Yep, okay. I need to make a note of all of this. How are you feeling currently? A little sore? Okay, yeah. Hopefully this exam will result in some antibiotics or something that will help treat any of the pains that you're feeling right now, okay? Yeah, I'm sorry that you're feeling that way. Okay. So, we're going to start with the proper exam now, and I just want you to open your mouth. Okay. I'm just going to feel around your jaw. So, I'm going to open your mouth. And then close your mouth and open your mouth again. Yeah. Okay. Feeling around your neck and your jaw. Okay. Now close your mouth and clench your jaw. Okay. Yep. Interesting. Okay. Interesting. I'm gonna put on my gloves. I'm going to have to now inspect it inside your throat. These gloves are a little too small for me. Yeah, they got the wrong size. I do have to only make do with one glove, so that's unfortunate, but one glove is enough. Now I need you to open your mouth. Open your mouth inside, and I'm just going to put this depressor on your tongue. And just inspect it inside your ear. Inspect it inside. And I want you to say ah. Say ah one more time. So you can close your mouth. So just seem like there's something. Okay. I need you to open your mouth again, and I want you to move your tongue to one side of your face, so like that. I'm just gonna inspect that. Okay. I also check along the side of the tongue, because that is a great indicator of whether someone has oral cancer or not. So you're looking fine over there, but you're just looking at the tonsils are the main issue in your mouth. Okay, now put your tongue to the other side. Okay, yeah, okay, all good. And then I want you to curl your tongue up, so like that. Okay, yeah. Inspect with the light. Okay, now I'm actually going to go inside the mouth. I'm just going to feel around the tongue area, so just feeling around the tongue. Okay, now I'm just going to check your upper teeth. I'm going to move your mouth up and then down. I'm just going to, it's going to be a bit sensitive, but I'm going to put my finger down that back of your tongue. It may cause you to gag, that is okay. I'm just testing the reflexes now, okay? Good. So just keep your mouth open, okay, keep your mouth open. Okay, now, close your mouth, yeah. Sorry about that. I need to use my hands again. So we'll give you a cup to rinse up the water. So sorry, to rinse. I'll give you a cup of water just to rinse out your mouth. Great, wonderful, 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 wonderful. Okay, so it's just going to be a taste test. You just need to tell me what you taste. Okay. Can you describe it? Okay, so that was vanilla, yeah? Just rinse out your mouth so that we can do another one. Could you describe it? It's very strong, yeah, that was bubblegum. And then one more. Oh, sorry, let's rinse out your mouth real quick. And then the last taste. That was, yeah, okay. So I did start with the weakest taste flavour profile, and you didn't get that. So, and most people do get that one because it's quite a basic scent, so that is indicative of what your tongue is telling me, your throat is telling me. Yep. Okay, so just checking your throat, that was all for your throat. Your gums are looking healthy, your tongue is looking healthy, it is the tonsils that I'm noticing the issue, so I do think you do have some form of tonsillitis, so we're going to have to treat that. Yep. Okay, we're now going to look to your nose. Testing your nose is quite short and simple, so yeah, but I just need to make a note of. So I want you to tilt your head back, and I'm just going to look inside your nose, and I'm going to inspect whether it's blocked. Do you have these? Help you open up your nose. Okay. Okay, yeah. Another nostril. Okay. So I'm still looking up. Can you breathe in and out? Okay. And then sniff. And again. Okay. So was there any struggle with breathing out, breathing in, or sniffling? Okay. Yeah, I didn't think there was any. It doesn't look inflamed or red or tender. Okay. Now, just do it here. We need to cover one of your nostrils and then breathe in and out. Breathe in and out. And the other nose, nostril. It sounds all clear. Just need to blow into this tissue. So that's just to send it into the lab. Yep. So just making a note of your nose. So your nose seems very fine, normal. I did suspect it was just your ears and throat, but because they're all connected, there was a possibility that something was going on with your nose, but yeah. So yeah, that was a very short nose exam, yeah. I could test one more thing, just for fun, because you know something. So just want you to breathe in and then out. Yeah, so you could see if there was misting for someone who can breathe with no difficulty, and yeah, but I didn't have to test that. Now it's going to be the ears. So the ears are the main attraction in this exam. Yeah. Me sanitize my hands once more. going to go with the otoscope. Which side of your ear is worse in terms of pain? Yeah, that side. Yeah. Let me check. Other side real quick. So now I'm going to be whispering words into your ear, and I just want you to tell me, yeah, okay? Yep. Strawberry. Yep. Water. Yeah, changed accents on you. Glue, yep, good. Cardboard. Yep. So from that whisper test and looking at your ears with the otoscope, it does seem like the left side of your face is a bit worse. There is a bit of wax build up near the back of the ear. Yeah. Okay. So I'm not an ear cleaner, but I can refer you to an ear cleaner. But it also is looking a bit like there's some sort of discharge in there, so I'm gonna have to treat you with some antibiotics before we do a further cleaning. Yeah. Okay. I'm now gonna see. I want you to close your eyes, and I'm going to press some buttons, and I want you to tell me which side you hear it on. Yep. Yep. Good. Yep. Yep. Good. Awesome. Yep. Great. This is the spray. I'm just going to spray away from your ears, but you'll be able to hear it. So I just want you to tell me which side of the ear you hear it on. Yeah? Okay. Yep. Good. Interesting. Yep. Okay, yeah. So I am going to prescribe you with 2 different antibiotics. So this one is for your throat to help with the symptoms of the tonsillitis, but we do, I think, have to get your tonsils removed. Yeah. And then the other one is, this is to help with the discharge in your ear before you go into an ear cleaning. So yeah, there are going to be 2 more trips to the doctor that you're going to have to do. I'm sorry. Yeah, but it will help. Yep. It also helps to hydrate a lot every single day. Don't skip. And water, make sure it's water. And then also just a facial massage, just to help drain anything from the face. Yep. Okay. So I'm going to give you these antibiotics, and I'm going to schedule for your ear cleaning and your tonsillitis, or tonsil removal, sorry. Yeah. Thank you so much for coming to the clinic. I am sorry for the unfortunate news. Yep. So I'll see you soon. Thank you. Thank you for coming in. Goodbye.